back, Dr. Habib. Nice to meet you. Thank you so much.
Thank you for inviting me. I'm looking forward to that conversation.
Yes, I'm really thankful for you to accept this interview because I've been following your work and I really feel the same way as you. I want to share all this information, and it's a pleasure to me that we can share this with the Hispanic community.
Sure.
So,
I was watching some of your social media. It looks like you practice what you preach as well.
Yes. I'm actually in this integrative field, and I want to share all the good information for the patients and want to help to the patients to have a good health too. And I want to ask you some questions. Bienvenido, Dr. Habib. Es un placer para mí poder hacer esta entrevista. He seguido tu trabajo y la verdad que da mucha satisfacción ver cómo estás ayudando a los pacientes, cómo promoves un buen estilo de vida, cómo das énfasis a una prevención en la salud. Entonces, muy bienvenido. Yo quería comentar que, bueno, el Dr. Habib tiene 2 centros médicos donde atiende a muchos pacientes de medicina integrativa, medicina holística. Entonces, bienvenido. Welcome, Dr. Habib, to this interview. And I wanted to start with a question. How did you start working? How was the path that you start working in this holistic and integrative approach?
Thank you for that question. I think what happens with conventional medicine is that we treat what we think is the disease, but we don't fix it. So when I started my own practice, I was getting frustrated that I wasn't fixing the blood pressure or the diabetes or the heart disease. So I started to look elsewhere to start to learn, because this kind of field that you're in and I'm in, functional medicine, is not in the curriculum. So then I went and learned and then built up my knowledge over the years.
Yes, because we learn in medical school that we will learn how to treat the symptoms, right? Not the actually root cause. And it's interesting that the feeling you have of feeling frustrated or for not helping your patients. And do you have some issues that you also were looking to resolve in your health as a doctor, as a conventional doctor?
So you're correct. A lot of people in our field, we go into it because of a personal reason, ourselves or our family members. Mine was just more of I was open-minded. So when I started my own practice, even though I didn't have knowledge about functional medicine, I opened my own gym because I liked the idea of staying healthy.
Wow,
and
awesome.
And practicing conventional medicine because I didn't know any of the other way. What I would say is that the conventional medicine is very good training to be aware of disease and how to manage it. But what we're talking about, you and I, is about chronic disease and how to fix it. Because from chronic disease, when you have a heart attack, you still have to treat it like an acute disease. When you have chronic high blood pressure, then you may have to deal with the stroke. So I think it's still good to know that disease, but the problem is that the treatment that we use to control disease doesn't reverse the disease. You have to use a different path. Luckily, I don't think that we're doing all the work. We just do give the body what it needs, and the body fixes the problem.
And what would you say is the main difference between a conventional medicine and the practice of functional, holistic, integrative?
Yeah, look, they're both good. So I think there are functional, integrative doctors or medical people, and there's purely medical people. I like to think of myself as both. Because you can have some doctors who don't do the natural and some natural people who don't do medical. So I do both. I think there's place for both. But I would say that, when a patient comes to me, they may have a problem. Even though they may look for a solution, they're really looking to feel good. That's all they want to know. They don't know the diagnosis. They came to me to look for a diagnosis. So most people, I realize, even after many, many years, it's still the same thing. They want more energy. They want to feel good. They want to keep their weight stable. And if they're smart, they'll want to keep their brain strong. So when they come to us, they don't know a disease. They're looking for us to diagnose. And sometimes we find something like blood pressure and we can manage it, or sugar and cholesterol. And sometimes there's nothing. It's that group of people that you want to be able to say, look, you don't have a disease, but you're not normal. So in America, we have a phrase which says that mere absence of disease doesn't make you normal.
Yes,
There's a
exactly.
big normal range, and disease is only a small part. The normal is the bigger part, but you can go down slowly. So it's important for us. Look, you seem very young, but as I've got older and I've had to practice it myself more and more, you find that you become more functional and your capabilities become better, doesn't go down.
Yes, because now you say that you are both, so you can, as you make the functional treatment to the patient will getting better, and also you are doing prevention of other diseases, right?
Got it.
That's awesome to know. I wanna know what are the most common diseases that you see in your approach?
Okay. So common is still common. A lot of people have a weight issue. They have sugar issue, even if they're not full diabetic. They may have high cholesterol issues. They have like borderline blood pressure. It's still the common problems, but the kind of people that come to me may be looking for other things beyond medication. They may be interested in fixing it completely, because not everybody is aware that you can fix it. Because we're the minority. You and me are the minority. The majority, the 97% of the medical system is based on the diagnosis and treatment, and nothing else exists. So people are already trained to think like that. So it's not the patient's fault for believing that. And so what you and I are doing through social media and education is letting people know that there is alternatives out there. So in America, we can call ourselves alternative medicine doctors because it's an alternative. You can call ourselves holistic doctors and integrative medicine doctors. But I like to just call myself a good doctor because I don't want to be labeled, right?
Yes,
so you and I know exactly what it means, but the average doctor may not know, and frankly, the people may not know. So we need to drive the definition of a good doctor by incorporating integrative medicine and incorporating. But the reason why I'm happy about that is because I have a license, I have the traditional knowledge, and I'm always learning the new knowledge, so I can argue very strongly without a fight, just argue very strongly my thought process of why I do what I do.
Yes, that's awesome to hear, actually, because when I talk to the patients like functional medicine, they think it's actually something new, but it's not new. It's just like how your body works and the information we actually get in these days, right?
So one of the ways I try to explain it to people is that when you're young, you imagine your function is high. As you get older, you can expect the function to go down as naturally, but disease doesn't happen until your function is very, very low. So when people say that I just got diagnosed, or I'm pre-diabetic, or I'm borderline blood pressure, they don't realize that they're quite low because the function went down a long time ago. And so for most people, as I said, they want to run faster, have more energy, look good. What they will be happy to hear is that if we can identify the decline and we make you physiologically more functional, not only can you prevent the disease, but you can feel better. So then they understand that mere preventing, we're not just preventing disease, we're making you feel at your best and function at your best. When your function is high, then you go down very slowly. And it's not about age. So we've been able to prove that with age doesn't have to come disease if you know how to slow down the aging process. So we can do that by preventing the diseases. We can do that by optimizing systems like the gut system and the immune system and the neurological system. But we can also use ways of biohacking now, because there are intrinsic mechanisms in the body that want to survive. So when you stress your body temporarily, the body activates these regenerative mechanisms, so you can actually be just as healthy when you're 50 or 60 or 70.
That's an awesome explanation, because people think that age is related with chronic diseases, because today we see most of the people using, I see in my patients between 40, 50, 60, taking already 1, 2, 3 pills and thinking that it's normal to do that. And that's an awesome explanation of how can we age but being the best of our health. They teach us that actually we cannot, but we're seeing the results. We're talking about you were mentioning about the gut, about the inflammation. What do you think are the root causes actually? What do you think are the root causes of most of the chronic diseases?
Yeah, in the Western Hemisphere, for the most part, it's because we're over-consuming. We're just consuming too many calories. We're stressing our system out. Because even science has evolved. So let me just give you this how things change. Because I'm older. Yes. When we were going through medical school in the late 80s, early 90s, we were taught to have a high-carb, low-fat diet. And that's become a problem. And so some of the things that we thought were normal then, it's not that it was wrong, but we've learned differently now. So I would say that that in the last 5 to 10 years, the knowledge about genetics and understanding individualized advice can make a huge difference. So I say that because even myself, in the last 5 years, with new technology and new knowledge, I've been able to sort of get to a higher level of functioning. And it's from that studies based on intermittent fasting and, just understanding how to stress the body with hypothermia and the type of exercising. And so even though I've got older, but I've actually become much more functional. And I can prove that because we have a lot of objective data in my office down to the brain scan. So when I look at my brain scan, what it was like 4 years ago to my brain scan now, it's improved at 3 levels. There is higher voltage, that means strength. There is an increase or a faster brain processing speed. So when I'm doing a task, we're actually measuring how the signals are being processed, and we're measuring the voltages and the speed. That has improved. And then the physical reaction time, that means that once my brain finally tells me to click something, we can measure that time. So all of those are faster. So this may be anecdotal, but for example, now, like my eyes, I still don't wear glasses for reading yet, even though people 5 years younger than me are doing that. And I don't think I had great eyes. I mean, I used LASIK when I was younger because I had bad eyes. But now that I'm older, I should be wearing reading glasses. I don't need it. And then examples like, something could be falling and I'll grab it with the corner of my eye, or something is moving and I'll catch it because my reaction time is so much faster. I'm not an athlete. And so what happens is that, having knowledge by studying and then having tools to measure, it really helps people understand. So I have normal people and I say, oh, your brain doesn't look like there has a lot of blood flowing. And by the way, you also have inflammation. So your brain is not going to heal until you get rid of inflammation. It makes it easier for them to understand what I'm saying.
That's really great, because it's like we are doing a puzzle game. Inflammation here and the gut here and the brain, and everything is connected in our body. So that's really good to hear that from you, because sometimes patients just want to get improved specific things, but then we realize inside the patient there's a lot of connections that are not doing well. And
so let
that's
me stop
awesome
you for a second. Yeah, so I know your name is Fernanda. Do you want to be called Fernanda or Nanda?
Oh, you can call me Nanda. I like
Okay, that's what I thought. Okay, Nanda. You hit the nail on the head. So when I do my physical, I tell people that all the different organ systems, they're like pieces in a puzzle. I have to understand the brain age, your immune age, your blood vessel age, your joint age, your gut age. Those are pieces of the puzzle. And when I put the puzzle together, now I can formulate a plan. So the reason I wanted your name is that, Nanda, you hit the nail on the head. You and I think exactly the same.
That's great to hear. That really makes me happy, because it's how we have to manage, right? The patient globally with all of the inflammation inside, not just only, as you say, you have a lot of patients that want to lose weight. I myself have a lot of patients too, but sometimes they want to lose weight, but don't want to change lifestyle, don't want to do some things that actually you have to be so wealthy inside that it can reflect the outside.
So in what you just said, I was always healthy in the 80s and 90s, eating high carb, low fat, but my body was always in a change. It was always a few pounds heavier. I could never see my six packs or abs. And then as I got older, and then like I said, in the last few years, they talked about how good the intermittent fasting was. And I said, let me try that because I don't eat that much anyway. Let me just stop. And then all of a sudden I found six packs that I think maybe when I was 20 years old, I may have felt I had it. But now I'm like much older and I can, your body composition changes. And so I think that the beauty of that is that if you can practice and see the results, then you can be sure of what the science is pointing, is that if we can slow down those signals for aging, not only should we be able to live longer, but we should be able to live longer without the disease. So it's both.
Yes. It's like we have to age, but with a quality of life.
Right. Healthy aging.
Yes, healthy age. Thank you. Which are the diseases? Because I was seeing in your webpage some reversible things you've been doing with your patient, and some people always ask me, no, you can reverse. You just can maintain. And I said to them, no, yes, we can reverse. And so tell me a little bit about the diseases you reverse in your approach.
I'll be happy to. So, in America, just with blood pressure alone, we only diagnose 40% of the people that have hypertension. And of the people we've diagnosed, we only control their blood pressure half the time. Very poor results. And then, as you know, if you're a medical doctor, that 80% of the blood pressure or more is what we describe as essential hypertension. That means you're just going to get it because you have a family history. But I'm here to tell you that I have a 90% record of reversing high blood pressure without any medication. And in the 10%, I may need a little bit of medication. So in the same way, if you have like early stages of diabetes, you can fix it. Of course, as you correctly said, the patient has to be involved with making the right changes. Even in complicated things like autoimmune disease, I'll have examples where they may be on 3-4 medications for rheumatoid arthritis, and still they're in pain with swelling. And at the same time, they have so many other complications where they have other evidence of autoimmune problems like diabetes requiring insulin. So you could call that autoimmune. They also have like diarrhea, gastrointestinal problems. So when I address those patients the right way, as you said, the different steps of the puzzle or different pieces of the puzzle and different steps, different organ systems, then you find that not only can you reduce their inflammation, you make the diarrhea better, you make the blood sugar better. So even if I can't cure everybody, because some people come very late, some diseases because of the genetics and other things, it's complicated. But what we can guarantee is that we can make you feel better with less medication. Because we will get to the root and make sure that we don't allow additional inflammation to take place.
Because it's like a teamwork with a patient, right? As a doctor, you put all your effort, all your knowledge to find the root cause of that patient, and the patient have to give us that trust and work as a team to get a healthy lifestyle. Because it's not just the treatment; you have to do with the lifestyle of the patient too, right?
Well, Nanda, you hit the nail on the head. When I sit with a patient, the first 10 minutes, I do not talk about their medicine at all. All I want to do is talk to them. I want to know who they are. I want to know about them. I want to know about their family. I want to know about their problems. Then we slowly, so I have the luxury with the type of medicine I do to be able to spend a lot of time with people. And I find it's necessary because you can't get to the root by rushing it. You have to kind of have a relationship. And just to give you a quick answer, the most important thing, no matter who is in front of you, you have to give them hope. Now, this is hope with a lot of substance, because as you and I go out and educate ourselves, we do have a lot of knowledge. So this is not just blind hope. It's like real hope, because you have experience, I have experience that, when we say the root of the problem is the gut, we mean it, but we may not start in the gut. Just because, for example, I've had somebody that has some gut problem, they have some blood vessel problem, but the real problem is that the brain doesn't work so fast. They have a bit of a brain fog. So when I showed them the brain scan to show, look, the hot area is only in the middle. Everything else is cold. That means the power and the voltage is not working very well. But before I can help your brain, which is what you really want, I find inflammation. I have to turn that off. I have to find ways to make your blood vessels healthy, because there's a barrier between your brain and your body called the blood-brain barrier. I have to make that healthy. And when I then nourish your brain with the right things like fish oil and magnesium threonate and phosphatidylserine, maybe some ashwagandha, then I can start to stimulate regeneration and have your body go through what we call regenerative neurotropic stimulation.
You have rejuvenate, right? You not just feel that rejuvenation, but you can see also in a scan, in a test that will give that information. That's awesome. You can see the improvement in your body.
That's right. What I was saying also is that I'm sure you share the same principles with me. When I give people therapy, what I do is I tell them to follow my 5 pillars, which is not rocket science. I'm sure you have the same. The first one is don't damage the sleep. The second one is don't put the bad food into your body. Then put the good food into your body. And after that, you may need to add more. We call that supplementation. And then because I'm a physician, my 5th pillar is I use power infusions with different ingredients to achieve my different goals. So sleep is very important because, as I was telling you, the brain scan that I saw could be because of an injury to the brain. We call that TBI, traumatic brain injury. It could be because of just sleep disturbance. So we have to understand that you have to follow those 4 or 5 pillars and then add the science to them.
Yes, and really, as you say, how important is sleeping well. But because I see a lot of in my consultation that people doesn't get a good sleep. People doesn't sleep well, and anxiety we're having right now actually it's worse. So how important is a good sleeping for a well-aged brain?
Absolutely. So all the 5 pillars, we have to remind our patients it's free, or the 3 or 4 pillars are free, and so what happens is the science is very strong. We may believe that sleep is good. We may believe that not sleeping is bad, but you don't have to believe. We have science to tell us that. So one day of lack of sleep will drop your antioxidant level. One day of lack of sleep will affect your gut motility and function. One day of lack of sleep will impact your immune system, so you become more vulnerable to infection. And so we know this because not only am I scanning people's brains, but we have science now to say that from the brain and the vagus nerve, you pass what we call cholinergic positive signals, and you can keep inflammation down. And in my studies, what they showed is that when they activated that pathway, starting with the brain, and stimulated this positive pathway, then they got lower inflammation in the gut. When they disconnected the pathway, the inflammation came back. So now we can't just say that for humans, but it's likely because we have lots of observation about sleep and the immune function with metrics, really. We have to believe that the brain is connected. And so when I have, say, a rheumatoid patient, and I'm doing a good job in managing things, but there's still a little bit of residual, and they tell me that, there's a little bit of stress, just like normal life. What we think normal, it's really not normal. We think it's normal here in the Western Hemisphere. But what you find is that half the immune system is probably in the brain. I say probably because the more data I collect, I'll be able to say for sure. So if I'm not getting results by changing the diet, fixing the gut, lowering the inflammation, replacing all the nutrients, just all the harmful signals altering, and I'm still not getting the good results, then I know that I've got to do something. So I have a therapy for the brain, which we call deep magnetic, transcranial magnetic stimulation, which is just a way to increase the voltage in the brain, which increases the blood flow, and the CSF fluid can circulate and repair the brain. Because you can't shake the brain. If you have a joint problem, I can put PRP injection. I can use physical therapy. I can use laser therapy. The brain, what do? We don't do very much. We do an MRI and a CAT scan, and that's it.
Yes.
So really, the 21st century is understanding signals and not cholesterol, blood pressure. Those are easy. Those are the low level. Signals are like inflammation. Signals are like oxidation. Signals are like immune regulators. These are the signals. And even that's not the disease, but we have to understand them because they end up damaging the mitochondria. So people say, I have no energy. They damage the mitochondria and the immune system. I get sick more often. So you can't be treating blood sugar, cholesterol, and diabetes and expect that you're going to have a strong immune system. That's not true. Sure, you're not going to have a worse system because if you have high blood pressure and high sugar, it'll be bad. But controlling them doesn't give you a good system. You have to invest in that good system.
Taking those things you mentioned as a lifestyle, in sleeping well, eating well, taking out all the foods that harms us. And it's interesting because we can put or we can take our health to a next level with a supplementation. And doing the base of good lifestyle, the supplementation will enhance our body, right? And just talking about that, is that I want you to talk a little bit about PRP for the patients, the results you're having with your patients.
Mm-hmm. Great. So PRP stands for platelet-rich plasma. And so what happens is that in your blood, you have these PRP, and if we spin them, I mean, you know this, but for your audience, yes, in your blood you have these special cells, and we have to harness them. So we have a special spinning technique, and we just get the most special cells at the bottom of that blood, and then because those cells are rich in growth factors, they're rich in immune cells. What they are, they're rich in helping your body heal. But if you can then inject them into the place where there's an injury, then you can get accelerated healing. For my part, what I do to get even better results, I mixed it with ozone. So ozone creates a reactive insult, a reactive oxygen species insult, which then makes that region stimulate regeneration. It's like the region feels like it's being under attack. It mounts a response. So that in combination with PRP, which is rich in these growth factors, in the site of the injury means that you can recover faster. So we can use PRPs after an acute injury like a sprained ankle or a ligament or injury like that. And then you can also use PRP to try to help regenerate even cartilage. We don't tend to use PRP for chronic things as such, more acute things.
I want to talk about also the IV therapy because it's really interesting that can accelerate the healing of the patient.
Yes.
So
yes.
I would like to know what are the most common diseases you're treated with IV therapy.
I will definitely answer that, but I just want to let the audience know that because I'm a physician, we're physicians, we like to have objective data. We call them lab tests. So even before I recommend a vitamin, I'll measure it and guide people that, your omega-3 level is low, therefore you need it. Your vitamin level, D level may be good, you don't need that. So when people ask general questions, they don't realize that I'm not a general doctor. I'm a real doctor that measures everything. So before they talk to me, they better know that I measure before I make my statements. So now I'll answer your question about the IV. In the same way, the IV, we can say we use it for clinical reasons. It's not that I'm giving an IV and I'm measuring the level in the blood and I'm trying to raise the level. I am looking for a response with a therapy. So just like the ozone creates an insult and then the body responds, I'm looking for the response as the therapy. So in the same way, the IV vitamin is not to just build your body up with vitamins. It does something. So it can reduce inflammation. It can protect the blood vessels. So with the COVID problems, they're using the IV vitamins in the New York hospitals because in China, they started doing that not only during this round of the COVID-2, they started researching that in relation to nitric oxide with the COVID-1 over a decade or two ago. And what you find is that both agents, nitric oxide and vitamin C, is that the IV protects the blood vessels so that in the lungs, where the blood vessels are attached to the lungs, by protecting the blood vessels, the lungs can heal. And that's why fewer people died when they combined supportive care, which is ventilation, with IV vitamin therapy. And they use very low doses, actually, but they use it 4 times a day. Here in America, in Norfolk, which is a part of Virginia, there was a sepsis, East of Virginia Medical School, ICU sepsis. In the sepsis ward, they would have 30% mortality. That means that of the people that were admitted with sepsis, which is infection all over the body, so severe, they have to go to the intensive care unit, up to 30% would die. After the doctor implemented intravenous vitamin C 4 times in the day, because these are people that are stuck in the hospital, you can do them 4 times a day. In combination with antibiotics, the mortality went down to 9%, from 30% to 9%, something like that. Is a huge difference.
Yes.
So, what people need to understand, whether it's oral vitamins, we always recommend real food first. We say the 5 pillars: sleep good, don't eat bad things, then eat good food, because food has cofactors and many other additional benefits and things it does to nourish the many factors, including the gut, not just nutrients. Then we supplement it because we want the body to have the right ingredients to function properly. Then we use the IV to boost it. So, for example, I can tell you for sure that as a physician, if I have infections, I give people the options. In America, we have to follow standards, because if we don't, they can take our license away. So I guide people to say the standard is, if you have a sinus infection, I can give you this treatment or this treatment, this treatment. This is an antibiotic, it will go through your gut and so forth. This is an antibiotic, I can do it through the vein. Or I can give you a natural way, and if you get better in 24 hours, you won't need anything. Would you like to try it? And they'll say yes. And so without going into too much detail, because you know that people, they may listen to part of my conversation and not understand the whole thing and then take it out of context, is to say that I offer the standard of care. Then I offer many other therapies that I have available. I have peptides, I have ozone, I have chelation, I have vitamin, I have many modalities. So I use the right therapy for the right patient at the right time. So what I would say is that in 80% of the case, I say 80%, I'll explain why. I don't need to use an antibiotic for the common infections, sinus infection, bronchitis, strep, things like that. Now, for the people where they have more serious infections, I am trained to treat the pneumonia. I can have somebody with 1-lobe pneumonia or 2-lobe pneumonia, something where it's not severe enough to end up in the hospital. Because, if you have a serious pneumonia, then you may need to go in. If you have a serious respiratory infection, and again, a trained doctor is able to make that figuration out. So we can look at the oxygen saturation. We can look at the heart rate. If it's racing at 120 or more, that will alert us to that this person may decompensate. So there's a time and a place where I make the judgment that I'm going to treat you in my office, or I make the judgment that you're not quite stable, because any treatment that I give you, there'll be a lag. You can't get instantaneous results. There may be a lag of 24, 48 hours. You may deteriorate. I must get you to the hospital first. So as a trained physician, it's very important to make that judgment. And that I can, even the serious infections where not serious enough to go to the hospital, I'll combine my natural therapies with antibiotics that go through the vein. So it's faster, it's more potent, and it won't disrupt the gut microbial flora.
Wow, that's
and I can
great.
make them recover in much fewer days. The reason I'm going to tell you the number of days, because there's going to be people out there saying that's impossible. So I won't even give the number of days, because it's impossible unless you see it with your own eyes and you are able to deliver on the results. Because I deliver on the results, everything I'm saying is things I actually achieve in my office.
With the IV therapy, everyone wants to get an IV therapy, but as you're saying, every patient has their own necessities. So yes, we have a lot of options to achieve the goals with a patient, but this one is not beneficial for that one. So really, we have to study the patient, see the markers, the inflammatory markers, and then make the approach, the convenient approach for the patient. That's great.
There are 2 additional observations with the IV vitamins that I found, again, in clinical. So there's 2 types of medicine that you see the numbers, they go up or down, and that's blood pressure and things like that. And there's blood tests that can go up and down. And the third one is what we call clinical. You have this problem, you fixed it. The problem was higher, you lowered it. It was lower, you raised it. That's clinical. So the 2 other really good situations are this, that when people come out of surgery, they have a wound and they're told it's going to take 10 days to get better. If they get the IV vitamin therapy, it'll be half the time. That's number 2. Number 3, I myself suffered from some gum inflammation. It wasn't bacteria, but it was inflammation, because the gut and the mouth are connected. So if I'm under stress and, I'm human, and there's a breach in the gut, I believe that the inflammation in the mouth came from the gut. However, the gut takes a long time to fix. I can't fix it in a day. So as I'm working on a global strategy to make my gut stronger, to reduce the global inflammation. What the IV did was it reduced the inflammation of the gum by 50% every time I took it. So it just made life easier, that there was less inflammation, less pain, less bleeding. And then at the end of the day, I realized that it didn't happen once, it happened a couple of times. So now I realize that, even when I think I'm not under stress, I have to listen to my body, because that's a sign of stress. Because stress is not something that's written on your forehead. You have to sometimes figure it out in retrospect. Maybe you have dry skin. Maybe you have just palpitation, but sometimes not that easy. Mine is like, it must be that it does compromise the gut, because I found that on a couple of occasions, I would get some evidence of leaky gut, and that's not good.
As you said before, we can make a biohacking in our body to enhance, right, the vitality.
Yes.
And everyone has stress, like as you said, you have stress. Well, I have a stress too, but if there's some tools we can give to our body to confront in a better way that stress, why not to use it? And that's awesome about the IV therapies, the ozone. It's really awesome to see that result.
Yeah, but just whilst you're talking about stress, let me give you some science there. That, we talk about sleep, that's a stress on the body. Too much exercise is stress on the body. A bad diet is stress on the body. Too much sunbathing is stress on the body. The body cannot differentiate any of these stresses. So what happens is that the people under stress, their stress hormones go down. So a stress hormone might be cortisol. If it's always being challenged, you may deplete and get adrenal fatigue. If you have testosterone under constant stress, like sleep problems or excessive exercise, you have low testosterone. So even young people have low levels. And then vitamin D is like a hormone. So in addition to not maybe getting enough sunlight, in addition to having maybe a liver problem and a kidney problem, because vitamin D is converted from the sunlight through the liver and the kidney, the problem is that even if those organs, you have to make sure they're good, but your body may use up that vitamin D as a steroid hormone because your body's under stress. So it's very important to understand that even when you measure levels, it can change because you are changing. Your environment is changing. It's your sleep, it's your stress. You have to think about that. And so the other part about stress is that it does have a direct link, because I was telling you that there are my studies to show how it creates inflammation one way and you can reduce inflammation another way. So it's very important to respect stress. And so when I see people with stressed brains, what not only happens is that not only is the blood flow in the brain compromised, but they're actually damaging the brain, because during stress, just like cortisol is being released in the body, it's released in the brain. And then there's a receptor in the brain, it's called GSK, and this cortisol will attach to that receptor and damage the brain. So it's like chronic damage, but you won't feel it, because unlike a sprained ankle, which gives you pain, the brain won't complain. So for those people, again, what we try to do is show them signs that are not obvious to them, that reflect how they feel, and then give them the tools to block that effect, right? So I may not be able to help them with stress today, but I can help them block that stress so that they can have time to repair it. So same with my stress, that I don't even sometimes know where the stress is coming from. I think I must just put the stress on myself, because I don't really have a very stressful life compared to an average doctor. But clearly I must put my own stress. And so whilst I'm waiting to figure out where the stress is coming from, I have to support my gut. And I do that now. Before, I just took it for granted that my gut is healthy because I have a great diet, my bowel motion is good, so I must be good. That's not quite true. I mean, of course, if your bowel motion is not right and you have bloating, gas, and acid reflux, you've got a real problem. But even when the bowel function seems good, it may not be good enough, because that's when the testing can show you that, there's a breach. Something is going on. So let me do it. So now I don't wait for symptoms or signs. I just constantly do something to keep the gut supported. Just like I tell people, and I have to realize this for myself, that I exercise to feel good. I exercise to keep my muscles active. And I exercise and do cardio to keep my heart strong. Different exercises for different things. But what am I doing to exercise my gut? The best exercise is probably intermittent fasting. But even stress and intermittent fasting puts a stress on the gut. So you must support it with amino acids and maybe some probiotics. So I've learned that, you have to, it's not aging, it's that in life, some stresses go down and other stresses might come. Life is never that easy, unless you're on a vacation and life is good and you're totally content. I just find that, in my world at least, and most of the world in the Western Hemisphere is like that. Maybe where you're from, you seem very relaxed, it seems a very nice environment. That's the environment I'd want to be in.
Yes, we have a lot of sunny days here, like 350 days a year. It's we have to enjoy that sunny and to have vitamin D. One thing more, if you let me to ask you, I would like to know how is your lifestyle? How do you take care of yourself? Because you were saying everything in life is you have sometimes with more stress, sometimes you're like having a leaky gut, but the idea is always to be in the in a way that we can make homeostasis in our body. I forgot it. The word
that's
in
correct.
English, like un equilibrio. The balance. Yes, it's actually to find the best balance in your day-to-day, right?
So that's a fascinating question. What happens that we as clinicians, we make these judgments when clients come in front of us, try to look at their balance and their lifestyle, but it's very hard to look at your own. So what I've learned to do over the years is learn to listen to my body. So what I'm about to say is probably common to many, many professionals and certainly people who drive themselves and who run businesses, which is that in order for us to achieve our goals, we work so hard. We don't want to hear about any problems in our body. So you drive through the sleep problem, you drive through everything. And then maybe as you go into the early 40s, you start to feel like, well, things are different. But even then, you may be in denial. It's like, nah, my gut's fine. I don't have a problem. So really, what I've learned to do is learn to listen to my body more, because now that I've made the mistakes that I did, I've learned the consequences. But at the time, I couldn't understand it because nobody was looking at me and telling me anything. Not that I would listen, because, I have things to do. I'm going to do it. But of course, I think that's why it's so important to have a life coach. And I think as physicians, we're not just here to help their health. We're here to help them in the way they function in their environment with their families and so forth, because it's when that environment is impacted, which then creates the disease. The disease doesn't come from nowhere. It's because you've made choices, and that choice is because of circumstance, and circumstances are because of work or family or children or something or finance, and then you get the disease.
And how did you apply in your lifestyle? Like you made some intermittent fasting, so you have
No, it's not that. It's much more simple. The first thing I did was I told myself, I said, so I made a promise in my late 30s that, if ever I get acid reflux or I can't sleep, insomnia, I'm going to give up medicine. It's not worth it. Why am I going to suffer and damage myself? So luckily, I never really got acid reflux or insomnia, but other things were complaining to me, like ligaments and joints, and, my mind wasn't as sharp. I told you. Then I started, without any disease, I knew that something wasn't quite right. So I would say that, you repeat your question one more time.
Oh, sorry. How is your lifestyle? How you take your approach to your lifestyle? Because we are doctors that practice what we preach. So I want to know how is your day-to-day? How do you exercise?
Well, let me tell you that. But the first and most important thing, I almost missed it because I was explaining things so much, was just to tell myself to slow down. Because I'm naturally a fast person. I'm a person that wants to achieve. So I am my worst enemy, because there's a price to pay. Maybe because of my genetics, and maybe somebody else with better genes could get away with it. So I am my worst enemy. So I had to convince myself that why am I in a hurry? Just slow down. And we're people of faith, so we leave it to God. But when you're younger, you believe in God, but you feel like, no, I'll do it. So now what I realize is that I'll work hard, I'll work smart, but I'm going to slow down and I'll let God drive the direction where I want to go. So my number one advice to myself was to slow down. And for other people, it's just to rebalance yourself. Now the trick is really, I think you have to just follow those 5 pillars. Before I would go to bed much later at night, now I go to much earlier. I understand why ladies talk about beauty sleep. I want my beauty sleep. I need to have my sleep, because if I have a good night's sleep, I have the best workout. If I have a good night's sleep, my bowels are better. If I have a good night's sleep, everything is better. It's like, why would I not want to have sleep? So with a few exceptions, because I want to do something, I may make exceptions to the rule, but I always try now. I'm much more conscious about sleep. But remember, that's our first pillar, right?
Yes.
So we practice my own pillar, which is don't put bad things in. So one of the things which you may not have had because you seem very disciplined, but as men, we're less disciplined. When I've worked really hard, I feel like I deserve that I can eat this, I can do that. And if you're exercising, you can burn it and you don't look fat. you think you can get away with it, but you don't really get away with it. So I learned that it's not just about the weight. You know, it does catch up. And I've got to learn to not eat that stuff because it's clogging up my liver. It's weakening my gut. So it didn't break, but it was not functional. So that's my second rule. Don't put the bad stuff in. So now I don't even desire things like that. Very rarely. I mean, I still have personal desire, but I like my espresso. I desire that. During this month, I'm not having anything. So I have to control my desire. But one of my favorite desires, I like to exercise. So I want to take care of myself so I can continue to exercise for decades to come, right? So it's important to understand that I still can enjoy things, but I need to figure out my priorities. I enjoy my coffee. I enjoy my quiet time. I enjoy my exercise. I enjoy travel. I enjoy my patients. I enjoy interaction. With the COVID, what happened is that there's such a slowdown in every way on the streets and environment in the office that, you know, my energy went down. So I had to build my own energy. So don't putting bad foods in and then eating the good food. So if I don't eat the good foods, my bowels don't work as well and I don't feel good. So I would say that it's those little changes. And so after I eat good, I think it's more important to stop eating bad stuff, then slowly improve the eating. And I've always eaten well, but now I can be even more careful. And then I have been very serious with my supplementation because I focus on, I look at my blood tests very frequently, not because I'm a hypochondriac, because there's changes. My vitamin D can change. Inflammation can come from nowhere. I was sick for a month around December, and I just dealt with it because I was traveling. I had no time. I didn't want to take an antibiotic. So I had a very low level bronchitis. Enough to cough, but nothing to make me short of breath. And then my blood test came back with a very high inflammation marker. My HSCRP was 11.5 or 12, way over any average inflammation mark. And so if I don't look at the test, then I may not have realized. I'm thinking, oh, it's nothing, no big deal. And sometimes it's nothing. It may be just low-level inflammation, like 2.5. Anything less than 1 is good. And I wouldn't have known because sometimes I can feel stiffness, sometimes I can't. So it's important to see the metrics. And when I see it, I want to take the vitamins to get rid of it quickly. I want to take the vitamins to support my liver's ability to detoxify. I want to take the vitamins to make my gut so that, like any organ, as it gets older, it's probably not as strong, but I want to stimulate it. You can stimulate it by putting the right foods in, not overeating, which is a challenge, and then supporting it. And then even the IVs, I do that on myself sometimes, and as well as other therapies that I have in my office. So in my office, I do hyperbaric chamber. I also do infrared saunas, things like that.
You have all the tools, then you see what's going on and didn't make a chance that to have a little of inflammation. That's great lifestyle, and it's good that you as a doctor share this with everyone that's watching us and how we can take the best care of our health, because it's difficult that we can make a change like from today and tomorrow. It's like we have to be the best every day, trying to work on the best of our health.
Yeah, you're exactly right. So one of the main things I say is that don't try to achieve all the results at once. Just take the first step and then take the second step. So there's two types of people. There's some people that say, tell me everything. I'm going to do everything the way you tell me. That's great. Then I just tell them everything. There's another type of people who need time. So you have to figure that out. Some people know themselves, or we have to understand what type of person they are. Yes. But all the time we have to give them encouragement and support. When things are good, you show them the good stuff. When things are bad, you say, I'm going to help you. Let's find a plan B. Let's find another way. So this state of mind is probably more important than the body. When this state of mind is better and strong, then everything will be easier. Because sometimes you can do all the right things and still feel you're not getting results because the state of mind is not there. We describe it as being in the zone. When you're in the zone, everything's going well. It's really a state of mind.
Actually, being with a patient, as you told me at the beginning, that you listen your patient, you make also like a coach, a health coach to your patient. You explain the why of the diseases, the root cause, and it's an education for the patient to be the best for make a change.
That's right. Well, yeah, you and I do the same thing. So where people need encouragement, you encourage them. Most important thing, you have to give them hope, and you have to tell them that you have the ability to help them, and they need to take the first step, and then we will help them with the rest. So I think that's important that as clinicians that we think of the total body, the mind and body together, and we build a relationship. So I find that I have most success where I'm able to build a relationship, then it's a relationship for the long haul, and you get the best results. because sometimes even when patient may not lose the weight, they're still very healthy. So a lot of times in America, we assume that being overweight results in diabetes and heart disease and cancer. That's not true. It's just an association. What I tell people, that the metabolism, the functioning of the body is such that it's leading to all of them at the same time. So the obesity also creates inflammation. The condition that allows obesity is the condition that also allows blood pressure. And that if you can deal with the root problem, then you can kill everything. You can lower the weight and lower the blood pressure at the same time. Weight is not the cause, because I have some people who are a little bit more mature, they're busy, they can't really do all the things you want them to do. But because they're healthy, they don't have blood pressure, they don't have blood sugar, they don't have diabetes, they don't have anything, and they're getting older. They're supposed to get worse, and they don't get worse.
It's been a really great interview for me. It was really with a lot of information. Thank you. I feel so happy that you shared all of your information with me, with the people that we're seeing. And also, if we have the opportunity also to interact in a social media, I really like to share all this information.
I'd love to.
And I like to bring to the people and the patients more information so they can take care of their own health.
That's right.
And how they have to realize that we're not only focusing now on like symptoms like high blood pressure, we're not focusing on conventional markers, but how the patient is feeling like in a lower level in the body.
Exactly. So we share the same thing. What we do is we help them, give them the tools, but they can achieve it. So we're giving them they take control of their own destiny, as opposed to we telling them what to do. And I've enjoyed this conversation very much. Hope we can do it again. I'd love to continue doing more of these things and educating more people.
Yes, it's awesome. Thank you so much for the opportunity. Hope my English was
fantastic.
Understandable.
It's fantastic. I wish I could speak Spanish like that.
Thank you so much for sharing your knowledge. It was really, really, to me, a great thing. With some concepts, you fulfilled like some things I didn't realize at all. So thank you so much. It was really a good interview. Thank you for your time. I know you are a busy person, and it was a great interview. Thank you, Dr. Habib.
Thank you. It's Friday, so you have a great weekend. All right, so take care.
Thank you. You too. Thank you for your time. Bye.
Bye-bye. Bye-bye.